Welcome to Healthrive. Today's video brings one of the most surprising and important updates of the year. For the first time in a long time, there is some genuinely good news for patients across the United States. Healthcare costs, something that has stressed families for decades, are finally seeing a shift that could bring real relief. If you or your family pay for doctor visits, medications, emergency care, or insurance premiums, then what you're about to hear may directly help your wallet. So, stay with me till the end, because this update could change how much you spend on healthcare in 2025. For years, rising medical bills have been one of the biggest financial burdens in America. Patients have faced increasing premiums, high deductibles, and shocking surprise bills that arrive at the worst possible time. But 2025 is shaping up to be different. New policies, pricing negotiations, and reforms are starting to bring down certain costs, especially for medications, preventive care, and some essential treatments. The impact is already being noticed, and experts say this is only the beginning. One of the biggest changes affecting millions of people comes from prescription drug prices. Medication costs have been out of control for years, especially for those with chronic illnesses. But new pricing reforms have kicked in this year, and several commonly used high-cost drugs are finally being reduced. This includes medications for diabetes, heart conditions, arthritis, and certain cancer treatments. Patients who rely on these essential drugs could see hundreds or even thousands of dollars in yearly savings. Many insurance plans are now required to place these medications in lower cost tiers, making them easier to afford. Another area where patients are seeing relief is in preventive care. More screenings and wellness services are being added at zero cost to the consumer. This includes new mental health evaluations, expanded diabetes screening, improved heart disease monitoring, and obesity management programs. The goal is simple: prevent bigger, more expensive problems before they happen. For families, this is a major win. Moms, dads, seniors, and young adults can now access services that once required out-of-pocket payments. By catching health issues early, patients avoid bigger bills later and insurers reduce long-term spending. Telehealth is another area generating big savings. Virtual care grew rapidly during the pandemic, and now, instead of scaling it back, insurers are expanding it. Many telehealth services now come with lower copays or even no cost at all. This doesn't just save money, it saves time, travel costs, and long waiting room visits. Mental health support, nutrition counseling, chronic disease follow-ups, and routine checkups can now be done online with minimal cost. This especially benefits people in rural areas, busy professionals, and anyone who previously avoided care due to cost or inconvenience. Emergency care is also becoming more affordable thanks to stricter enforcement of surprise billing protections. Patients who go to the emergency room should not be punished with unexpected charges, especially when they had no chance to choose an in-network doctor. New updates in 2025 expand these protections even further. More hospitals and emergency providers are required to follow these rules, reducing the risk of receiving a shocking bill after a stressful medical situation. Families facing emergencies can now breathe a little easier, knowing they are safer from unexpected financial shock. For the first time in years, some insurance premiums are stabilizing or even decreasing in certain states. This is a major surprise for many Americans who are used to premiums rising every year. Improved government subsidies are also reducing monthly costs for people who purchase insurance through the marketplace. Millions of Americans now qualify for lower monthly payments than last year. If you haven't checked your eligibility recently, you might be paying more than you need to. Many people are discovering they can switch to a better plan for less money, simply because of updated subsidy rules in 2025. Deductibles and out-of-pocket maximums are another area where many consumers may see improvements. While some plans still have high deductibles, regulators are lowering some limits to protect patients from catastrophic costs. This especially benefits families with chronic conditions or those who use medical services frequently. If you've struggled with a high deductible in the past, this year could offer some relief, especially if you compare plans carefully and choose one that fits your medical needs. A major update that patients are celebrating is the expansion of coverage for mental health treatment. For years, mental health services have been difficult to access due to high costs and limited coverage. In 2025, many insurers are increasing their mental health benefits, making therapy, counseling, and psychiatric care much more affordable. This includes both in-person and online services. With mental health issues rising across the country, this change is one of the most meaningful improvements of the year. Another surprising source of relief comes from hospitals themselves. Many hospitals are now required to provide clearer pricing information and more transparent billing practices. This means patients can see expected costs before they receive care, rather than being surprised afterward. For surgeries, procedures, imaging tests, and specialty treatments, clearer pricing helps people plan better and compare options. Hidden fees and unclear billing have caused stress for millions, and reducing this confusion is a major step toward fairer and more predictable healthcare. Families with children are also benefiting from new cost reductions. Pediatric care is seeing expanded coverage, including developmental screenings, speech therapy, evaluations, and additional wellness checks. Parents often worry about unexpected medical bills for their kids, but with more services covered at little or no cost, many families can now access the care their children need without financial stress. Seniors on Medicare are experiencing some of the biggest improvements. Out-of-pocket spending for certain high-cost medications is being capped, and more Medicare Advantage plans are offering dental, vision, and hearing services at lower costs. With more seniors relying on fixed incomes, these savings can make a meaningful difference in their daily lives. Even employers are stepping up. Many companies are adjusting health benefits to reduce costs for their workers. This includes expanding employer contributions, improving maternity and family benefits, and offering more affordable plan options. Employees who haven't reviewed their health benefits this year may be missing out on new savings and perks. While not every cost is decreasing, some treatments and specialty services may still remain expensive. The overall direction for 2025 is more positive than the United States has seen in years. And although the system still has a long way to go, these updates show that real change is possible. But here's the key point. None of this helps if people don't know about it. Many Americans will continue paying high prices simply because they aren't aware of these new policies, updated subsidies, and expanded benefits. That's why staying informed is one of the most powerful ways to protect yourself financially. So take a few minutes to review your insurance plan. Check your subsidy eligibility, review preventive services, and verify medication tiers. A little research can save you a lot of money in 2025. Thank you for watching Health. If this update gave you clarity, relief, or useful information, make sure to subscribe, like the video, and share it with anyone who needs to hear about these positive changes. Healthcare can be complicated, but together we can make it easier to understand. Stay healthy, stay informed, and I'll see you in the next video.